808, which brings us to a really significant total of 161,065 Victorians now having an active case of coronavirus in our community. Of those 17,190 for the rapid antigen tests, just under 9,000 of those reported back that they had taken that test yesterday. In regards to today being a milestone event for the kicking off of the pediatric vaccines of 5 to 11-year-olds, that's a big milestone in our vaccination program as a nation. And I want to thank every parent and every carer and, of course, every child in that 5 to 11-year-old group for doing what they need to do to keep themselves safe. From today, those kids can finally get the same protection that 12-year-olds and above have been able to get for some time. And in doing that, those kids and their families are helping to protect us all. We've had more than 40,000 bookings in the last 7 days through our state-run system, and we know that there's been a much greater number of that, be it through the GP network or the pharmacy network. And we have more than 43,000 available bookings over the coming weeks, which can be increased in response to demand should they fill up. But of course, so do our pharmacies and our GPs as they continue to lead in this important space. You will have seen that yesterday the Premier reissued the pandemic declaration under the new legislation arrangements. The initial declaration was for a month, and now in 3-month processes we roll out this process here into the future for as hopefully as short a period as possible. But that's given us the opportunity to reflect on a range of things, and particularly the fact that we are seeing hospitalisation rates continue to grow both here and around the nation. And we've said for some time that it is those hospitalisation rates that are the issue of most profound concern for our public health team and for the Victorian community as we deal with this significant Omicron spike. This time last week, we had 491 Victorians in hospital with COVID. Right now, it's 818. Through our rapid antigen test reporting and engagement program, we now know that we've got a huge increase in COVID cases across our community. And that builds, of course, on top of our PCR system, which faced being overwhelmed in this Omicron spike. The last few days, we've seen pretty much the same number of PCR tests coming back positive and people self-reporting on rapid antigen tests, their COVID status, and the system of ensuring that duplications and crossovers is now starting to work very effectively as we align that data for a better picture of what the COVID cases in our community are. Based on all these concerns, particularly the profound increase in hospitalisation numbers, the Acting Chief Health Officer has provided me some further advice on sensible measures to take to respond in that public health and social measures to build on the great work that vaccines can provide us as dealing with that increase in COVID cases, and so doing, knock down as quickly as we can those increasing rates of hospitalisations, those increasing rates of people in ICU, and those rates of ventilation and, sadly, deaths. So these measures also extend to making sure that in our critical areas of workforce, we take a series of measures, including mandating further third-dose vaccines to make sure that those workforces are safe and that helps drive down that spike. So we know that with 93% of Victorians now double dosed, that has put us in a very good position to respond to the COVID-19 cases when it was a Delta variant, and we're now having to move on and deal with the Omicron variant. But it's clear that we do need to increase our rate of third dose coverage to address that matter. And that's why under the new pandemic orders that I intend to sign off today, the following workers will soon be required to show evidence that they have received that 3 vaccine dose, including the third dose, or to have a valid medical exemption before attending work. And those groups are healthcare workers, aged care workers, disability workers, emergency service workers, correction facilities workers, hotel quarantine workers, food distribution workers, including manufacturing, warehousing, transport, but both freight and port workers involved in food distribution, but not at this stage, the supermarket retail workers. But I'll have more to say about other groups shortly. And finally, the abattoir, meat, poultry and seafood processing workers. All of these groups are already covered by existing mandates for those first 2 vaccinations, and this is a sensible addition for the relatively high-risk nature that these sectors operate when it comes to vaccine protection and, of course, their critical contribution to keeping Victoria operating. In regards to timing, if they are already eligible, these workers in these groups, for their third dose, which many of them will have been, at or before the 12th of January, they will have until the 12th of February to get that third dose. So, if we can be clear, if you work in one of those sectors that I've just gone through, and you are eligible now for your third dose, meaning you got your second dose 4 months or more ago, then you have until the 12th of February to get that third dose. If you're a worker in those sectors and you are not yet eligible for that third dose, then you will have up to 3 months from when you are required to receive that from when you're required to receive your second dose, plus 2 weeks. So effectively, given the different dates that cut in for those different sectors in 2021, this means that all residential aged care workers will be vaccinated with their third dose by the 1st of March 2022. That's because their second dose deadline was the 15th of November. All disability, quarantine, correctional facilities, emergency services, abattoirs, meat, poultry, seafood processing workers will need to get their third dose by the 12th of March. That's because their cut-off date for the second dose was the 26th of November. All healthcare workers will be vaccinated with their third dose by the 29th of March, and that's because their second dose deadline cut-off was the 15th of December. The Acting Chief Health Officer has also recommended vaccine mandates due to the fact that there is an increased risk of COVID exposure, like there is to every Victorian, to these groups. Also because these people work in particular vulnerable circumstances when it comes to exposure to people who are vulnerable and who are particularly vulnerable to COVID-19. And of the higher risk of their workplaces needing to continue to operate in this COVID environment, and the need to protect essential services and provision of these services to the Victorian community. I should stress that there are significant other sectors of the Victorian community also covered by that first and second mandate for vaccines, and we are currently closely examining what further measures based on this risk and what consultation and support needs to be provided to those sectors to bring those sectors also into line with future vaccine mandates. That work is quite active at the moment and will ramp up, and we'll have more to say about future vaccination mandates to achieve those same goals in the near future when that work is undertaken. Some of the other public health and social measures that will also be enacted based on the advice that I've received will also be implemented as of the 12th of January when this new set of orders rolls in. And they go to sensible measures to reduce the risk of COVID-19 circulating in our hospitality, in our disability and aged care sector, and in our health settings. So, some further measures that will be brought in from 11:59 p.m. on Wednesday include indoor dance floors with hospitality and entertainment venues will close, and those venues can still operate, and there are no changes to density settings currently in place. Indoor dance floors at weddings will be excluded. They can still operate from this closure due to the unique life circumstances that weddings bring, and the advice that overwhelmingly such events, it is a known crowd and the ability to get in contact with them is significantly increased should there be any issues. Having said all that, wedding hosts and guests should strongly consider the prospects of ensuring that such dance floor events, should they occur, might best be held outdoors. Other recommendations that will also be included in those public health orders go to how we can protect those workers and steps that you need to take to protect each other. They go to making sure that, Ben will go through this a bit more, how measures to protect aged care facilities will be undertaken, and further measures for testing and vaccination requirements before entering hospitals. In regards to areas of strong recommendations that will be part of this, we continue to strongly recommend that if you can work from home, that you should work from home. We strongly recommend that if you can study from home, and you're required to study at the moment, then you should study from home. And equally, a very strong recommendation that for those facilities in hospitality that are open, that and continue to be open, that seated service be part of those opening arrangements.